Hey everybody, my name is Dr. Kelly Peterson, also known as the Belly Whisperer. I wanted to go live today to kind of tell you a little bit about myself, what I do as a physical therapist, some of the resources and things I can offer. So feel free to ask any questions as you come along. People will kind of be coming in and out, and if you have any questions, you can put them in the comments. I also will maybe be answering some questions that I've been seeing a lot under some of my recent videos. So if you're just joining in, welcome. My name is Dr. Kelly Peterson, also known as the Belly Whisperer. I'm a doctor of physical therapy, but I specialize in pelvic and visceral physical therapy. So a lot of people don't really know what that means. Visceral therapy is viscera, meaning the organs. It's manipulation of organs, fascia, connective tissue to help with restoring movement, motion, function. And then I also do pelvic floor physical therapy, which is working on the same thing as regular physical therapists. It's just the musculoskeletal part of the pelvis, our pelvic floor muscles. I wanted to show you last time during my live how to use pelvic tools, right? Like the Kegel weights, dilators, the pelvic wand, but TikTok censored it and I got banned for a week. So I'm gonna avoid using any tools or have any models or anything that TikTok may deem as inappropriate, but that's okay. I'm just gonna be talking, and if you have any questions about anatomy, pelvic, anything like that, like I said, drop them in the comments. We're gonna get to that. So basically, I'm a physical therapist. I work full-time in Orange County at an outpatient clinic doing pelvic, visceral, and orthopedic physical therapy. I also just started my own business last year, going as the Belly Whisperer. So what's nice is I offer online consultations. I know a lot of us right now, especially during the pandemic with COVID, we have a lack of resources, or even before COVID, maybe you don't have anybody in your area that offers a pelvic floor or visceral physical therapy. So I do online consultations through my website. I have a link in my bio to my Squarespace website. It's thebellywhispereroc.com. So you can go there if you want to look up different consultations. I offer a 15-minute one. I offer 30 minutes, an hour, and then I also offer in-person appointments if you are lucky enough to be a local of Orange County. Obviously, I'm repping my Disneyland shirt because if you don't know this about me, I'm a huge Disneyland fan, and I go a lot typically when it's not COVID. So if you are local, I do offer in-person appointments. Sometimes I go to people's homes if they are nearby, but typically I have a new office space, so I'm really excited. I just now am renting out of an office a room where I can treat patients now for pelvic, visceral, and orthopedic injuries there in Irvine, California. So if you are a local Orange County resident, like I said, you can book those in-person appointments online. I offer hour-long appointments with one-on-one specialized care. If you are not local, don't worry. I have videos, I have online appointments. My new website, which is on the teachable.com, it's really great. I've uploaded kind of courses with videos for a variety of different illnesses or issues. For instance, if you're somebody that is pregnant or postpartum, there's awesome videos on C-section scar mobilization, how to tape using kinesio tape. If you're somebody that suffers from painful penetration or difficulty with arousal, I offer videos using a lot of the tools that I show in my videos, especially by Intimate Rose. They're a brand that I love using a lot with my patients. I show videos on how to use the pelvic wand, how to use dilators, and then also another thing that I do, which is really cool, is I love to work on the belly. That's kind of where I got my name. I do a lot of specialized visceral therapy, but I also will use tools like instrument-assisted tools or also cupping. So a lot of us know about the traditional cupping, or you maybe have seen cupping marks on Olympians, or if you watch professional athletes. I use cupping to help with moving tissue in the abdomen, especially for people that suffer from constipation. This is something that is really underdiagnosed, and a lot of people are actually more constipated than they think, and this is causing people to have a lot of issues like bloating, indigestion, reflux. So it's a huge thing. So what I do is I'll do specialized treatments to help with that, because if you're somebody that is blocked up anywhere along the colon, the ascending, transverse, descending colon, this can lead to a variety of issues: pelvic dysfunction, stomach pain. And a lot of times people will go to a variety of doctors. They'll see maybe their gynecologist, their primary, they'll see an endocrinologist, they'll see an OBGYN, a urologist, and they won't really understand, or they cannot find the source of what's going on, and that's where I come in. Okay, so I look at the big picture, right? Maybe something that you have going on with you isn't actually like mechanically or biomechanically wrong with you. Maybe it's just that you're a little bit backed up because of maybe you had your gallbladder removed, or maybe you had a C-section, or you have scar tissue from an old injury. Maybe you have scoliosis, or your posture at work is really bad. So all day long, that's impeding your digestion. Maybe you wear really tight clothing, right? A lot of women's clothing is super tight, especially high-waisted leggings. I love them. They're very comfortable. They're fantastic. But sometimes all that pressure on the organs and on the abdomen can really affect our breathing and also our digestion. So it's nice when you can, when I have you one-on-one, I basically go through your medical history and figure out what's going on. Are you on any medications that could be causing you to have any issues? What's your diet and exercise look like? Some of us, unfortunately, like me, have food allergies, right? I have, if you've been following me and you know, I have IBS. I was misdiagnosed with Crohn's disease and then celiac disease. And then I finally had an endoscopy and a colonoscopy, and they found out I had ulcerative colitis, and I had all these other issues going on. And once I was able to get on a regimen and doing not only just diet, but also my method that I use on my patients called the belly whisper method, it changed my life. And I tell people I don't use medications, I just eat healthy. And the only thing I do is I am gluten-free because of my IBS and celiac. But it's really amazing what you can do using visceral and pelvic floor physical therapy to help with some of those issues. And I know a lot of us suffer from, having food intolerances or bloating, especially if you're a female and you're menstruating, right? Every time during that month, it can be extremely painful and debilitating for a lot of us, difficult to go to work, especially if you're somebody that has PCOS, endometriosis, adenomyosis. These are a diagnosis that get misdiagnosed all the time, underdiagnosed, and you have people suffering for years not realizing they have something going on. So that's another thing that pelvic floor physical therapists can do to help with that. Also, a lot of women have difficulty with inserting a tampon or with penetration, right? Because of vulvodynia, vaginismus. Maybe you just have a hypertonic or an overactive pelvic floor, and every time, something comes near there, you clench or you tense up. So, and this can affect, a lot of my patients come to me being in marriages, being in long-term relationships, and this can affect, intimacy with your partner. It can be, really frustrating, and you can feel very alone. But I promise you that there are so many other people like me out there that do pelvic floor physical therapy, and there are other people that have these same complaints. A lot of times, especially I find my female patients are really, afraid to tell their partner that they have difficulty with arousal or climax, that they're having pain during intimacy with their partner. So this is something that's really important. It's not talked about. It needs to be talked about, just like, constipation, hemorrhoids, all of that. Like, for instance, if you're somebody that has hemorrhoids and you don't really do anything to treat it, it may just be getting worse because there's a reason you've got the hemorrhoids, right? For instance, yes, maybe you were pregnant and all of the pressure of the baby, the weight gain, all of that caused you to get hemorrhoids. But then once you're postpartum and all of that, maybe you actually hold your breath when you're having a bowel movement. Maybe you hold your breath when you're lifting. Maybe you don't eat enough fiber. Maybe you're chronically constipated and now your hemorrhoids are getting worse. Same thing with prolapse. A lot of us are walking around with a grade 1 prolapse, meaning, right, our pelvic organs should be in a certain position inside of our pelvic cavity. I always talk about this. Our pelvic floor is like a hammock in between one sit bone. It keeps our organs in place. It helps with sexual function. There's so many things, but prolapse, if those organs start to drop because of pelvic floor weakness, heavy lifting, stress, obesity, there's different factors that increase the risk of prolapse. this will only get worse if you don't change those habits. So it's really important to see a therapist near you that they can help you figure out why you're getting these symptoms or these issues, and then how to change it, okay? It's a pelvic floor physical therapy, definitely a little taboo, but I'm telling you, there's more people out there practicing, and I think in the years to come, it's gonna get a lot more popular. The stuff that I do, the visceral therapy, that's definitely different. For instance, let's say you're having a lot of stomach pain, and when I do my assessment, I find that your stomach is rotated, it's out here, and it really should be over here. I can go in and do fascial manipulations to help with returning that to its normal position, because if your stomach is out of place, that can affect what's going on as well, okay? But yeah, if you're just joining in, thank you. Like I said, my name is Dr. Kelly Peterson. I also go by the Belly Whisperer. I've just been talking about different things that you can do for yourself if you're suffering from any pain, pelvic floor dysfunction, stomach issues, chronic, acute, and how physical therapy can help, especially with my new method that I have. I am working right now on trying to film an entire modular course that people can access anywhere and do from their home. It's going to take a little bit of time, but hopefully I'll have that out maybe in the next couple, maybe 2 to 3 months. This method is really focused around what I tell people are the 5 B's of my method: breathing, bending, belly position, bracing, and belly support. These 5 things encompass my method. If you don't know how to breathe right, if you have terrible posture, if you don't know how to activate your core, if you're inflexible, or you have bad bending ability, and if you have no belly support, meaning you haven't seen a doctor, you have, family or friends that aren't around to help you, if you haven't seen a dietitian, maybe a gynecologist, a gastroenterologist, you're going to want to do all of that, because when it comes to having any type of chronic abdominal pelvic issue, you're going to need a lot of support, and you're going to need a lot of different things. Anytime anybody tells you, like, if you just do this, like, everything will get better, if you just take this pill, everything will get better. In a perfect world, that sounds fantastic, but when you take medications, or if somebody says, here's a one-size-fits-all, they're probably lying to you, or it's not necessarily going to be effective, right? It would be nice to be able to take a pill for every type of injury and every type of issue, but to be honest, a lot of injuries or things need multidisciplinary different health practitioners, So for instance, if you are somebody that has, let's say, irritable bowel syndrome, PCOS, endometriosis, anything like that, you're going to want to have, your primary involved. You're going to want to have maybe an endocrinologist, your gynecologist, maybe you need a urologist. And of course, the mental component of it, right? The psychology aspect. I think this is another thing that's still very taboo. I don't know why, because mental health is just as important as our physical health, right? So this is something too that you're going to want to look into if you're someone that is suffering from chronic pain, right, or trauma. A lot of people that have pelvic abdominal issues also suffer from some type of maybe verbal trauma or physical trauma, and then this manifests in their body, right? Tmj pelvic pain. There's a correlation between that, right? Because a lot of people that have issues down there, they might be clenching down there. Our nervous system is like a highway that runs from our brain all the way down to our pelvic floor. If you're clenching down there, it can still affect those nerves up there. So for instance, you could be clenching here, and that's why your jaw is popping or clicking, or you're having chronic headaches. So, when you're seeing a health practitioner, especially a physical therapist, you need to have somebody that looks at your entire body. If you're seeing the same therapist, the same physical therapist over and over, and you're not seeing any results, especially after 12 visits or maybe 6 to 8 weeks of treatment, you need to find a new physical therapist. You need to find a new doctor, because that's not normal, right? You need to figure out what's going on. Everything will always have an answer. There will always be a source of what's going on. You just need to find that. That can be the hard part. And a lot of people feel very bounced around, or you'll hear doctors say, oh, you're having pelvic pain during, you know, penetration, well, just relax, you know, drink some wine or stop stressing out. Well, that's really not a good solution, right? If your doctor is telling you to just relax or, you know, drink some wine, that's not helpful, and you need to find another doctor that's going to actually run tests, that's going to send you to specialists, okay? You need to find somebody else, because that's not a good answer, okay? Thank you everybody for joining in. Like I said, if you're joining in now, my name is Dr. Kelly Peterson. I'm a physical therapist. I kind of wanted to come on and talk a little bit about what I do and how I help people. I'm really, really passionate about the stomach and the pelvic floor. They go hand in hand, right? What you eat, everything, digestion when it comes out, all of that is super important. A lot of us know about like the traditional type of physical therapy, right? Like frozen shoulder, rotator cuff tear, you know, neck pain. But a lot of us don't think about that stomach pain or pelvic pain, or maybe, for instance, your sciatica, your radiating hip pain, your groin pain, your tingling down your leg. You know, that could be something that's coming from your pelvic floor. That could be something that's coming from scar tissue or restrictions up in your abdomen. So that's why visceral physical therapy is such a specialty, and it's such a great tool to find out what's going on and how to better treat you, okay? You know, typically orthopedic physical therapists, most physical therapists specialize in orthopedics, right, sports. Now there are other different fields, right? There's pediatric, you can do wound care, lymphedema. Physical therapy is awesome. There's multiple specialties, but a lot of us all do orthopedic, your general ankle sprain, knee pain, hip pain, you know, that stuff to me is easy. That's why I got into what I do, because I had so many men and women coming in having issues with urination, painful penetration, leaking, having flatulence issues, but not being able to control farting. So this is super important. I think I have a question. I'm gonna pull this up here. Awesome. Bear with me, this is my second live. My first live got taken down because I had pelvic tools. This question, can bloating be a pelvic issue even for men? Yes. Okay, I'm so glad this person brought this up. This is a fantastic question. A lot of people don't realize that males also have a pelvic floor, okay? Let's put it all out there. We all have the same parts down there. They're just organized differently, okay? I know that's really hard to visualize, and I really want to go into the detail of that, but if I start using some of the words down there, let's start with a V or a C, TikTok is going to flag me, so I'm going to have to like kind of gloss over this. But yes, males have pelvic floor issues just like women, and in fact, I would argue that males tend to be suffering in silence even more than women. I think women tell their doctors that they're having leaking and issues, and their doctors will say, oh, well, that's normal, you just had a baby, or that's normal, or this is normal, when it's abnormal, right? But men, because of the way the ureter, which is basically the tube that your urine kind of, basically you have your bladder here, and then you have a little tube that comes out and basically that's how you can pass urine. That ureter runs right through the prostate. And when you get older, right, a lot of men can get enlarged prostate, prostatitis, prostate cancer, right? 50% of men over the age of 65 will develop prostate cancer. So when that happens, it's going to affect your urination, your ability to pee, your ability to, not let yourself leak. So this is a huge problem with men. But a lot of us just, they suffer in silence. They don't tell anybody. But yes, men need pelvic floor therapy too. And for specifically, the bloating, sorry, I'm going to take a sip of my coffee. Specifically the bloating that you're talking about, if you're a male and you're having a lot of bloating, it probably could be due to constipation issues, indigestion, something going on. You may have some type of food allergy or intolerance, but same thing. So when I'm working on a male, I typically do females more commonly in the clinic, but when I work on males, yes, I can still assess the pelvic floor muscles. Basically, I just go through, I just check through their bottom, right? So A lot of people get really freaked out about pelvic floor physical therapy because it is kind of intimidating to have somebody going down there, right? Especially, you know, male or female, right? Females, you can imagine, we have 3 openings, you know, our bottom, our front, and then I'm just gonna say it, I don't care if I get taken off. You have your rectum, you have, your anus, your rectum, and you have your vaginal opening, and then you have your urethra. Those are our 3 openings. For females, males, it's the urethra, right, the tip of the male, and then also the rectum or the anus. So if you're a male, if you're gonna have pelvic floor physical therapy, if you are comfortable and you give consent, then yes, we'll go in there and we will assess the pelvic floor through that direction, excuse me. But that does not necessarily mean that if you see a pelvic floor physical therapist, you have to have an internal assessment or internal exam. I treat plenty of patients and I don't have to have them undress at all. I don't have to do anything down under, and in the sense of I don't have to do anything that feels that intimate or that personal, especially if you're somebody that has suffered from trauma, okay? If you are seeing a pelvic PT and they're telling you have to have an internal assessment, that's a major red flag. That's not okay. You always have autonomy when it comes to healthcare. That means you have the right to what happens to your body. So as health practitioners or as medical professionals, we are trying to do our best to tell you what we think is best for your body, and you pray that you meet somebody that really tries to treat you like they would treat themselves. I tell my patients that, I always tell them, I treat my patients, or I'm treating you as if you were my mom, as if you were my grandma, you know, you're my husband. I'm not going to give you something that I feel is going to harm you, because I wouldn't want to do that, okay? And if you feel like you're in therapy right now and you're not getting that benefit, please talk with your therapist. They should understand. Let them know, okay? I have too many patients come to me and they'll tell me that they had a horrible experience with physical therapy and it was painful and they hated it, and I feel so bad because physical therapy is honestly the center of my life. I think it is so beneficial in so many ways because it's not very invasive, and typically it either helps people or you don't feel that much change for some people, and maybe you need surgery or you need another type of management. But if you're someone who your doctor is telling you you need to have surgery, I highly recommend seeing a pelvic floor or any physical therapist for that matter first, because you may not need the surgery yet, okay? But yeah, going off that again, males and females both can have pelvic floor issues. Like I said, I treat mainly females more often, but like I said, I've treated a lot of males with different stuff, spinal cord injuries. Men can also get chronic UTIs or chronic infections, which can cause them to have pelvic floor issues. That's a big, another thing that gets misdiagnosed a lot is women or men even getting chronic urinary tract infections, and their doctor gives them antibiotics and it keeps coming back. Well, you may not have a UTI. You need your doctor needs to actually run a urine analysis to see if you have the infection, and then what strain, to give you the right antibiotic, because they may be giving you the wrong one, or you may have something like interstitial cystitis, right? Bladder inflammation that's not caused from an infection. So, like I said before, there are so many different things that could be going on causing types of abdominal pelvic dysfunction. Seeing somebody like me or what I do, the visceral and the pelvic floor, is going to help so much. It's going to give you a bigger picture than what you've already kind of have in front of you, because like I said before, although people that find me online, they are at the end. They feel like they've seen everybody. But I urge you, even if you've seen 2 physical therapists or you've seen 2 doctors that you feel like you're not getting any progress, keep going. There's somebody out there that's going to help you with whatever problem that you have. A lot of people, I think, get to a point where they feel like their pain is chronic or their issue is hopeless. But you don't realize there are, you know, thousands of brilliant minds out there, and they're all trying to help people. And they're also on the internet. There's people that aren't even on the internet, not even on, you know, trying to deal with things like TikTok and social media, that are brilliant at their job. So that's something to really consider. I'm gonna see if there's any more questions. I want to answer a really funny question. So, sorry, I'm having a little bit of coffee. So, somebody in one of my comments in one of my videos asked me about the O-shot injection. Now, I don't know if any of you guys have heard of the O-shot injection, but basically it's like PRP. Oh, Phil's nice. It's PRP. What is it? Platelet-rich plasma. Excuse me. It's really a very popular thing right now, and there's a lot of good evidence-based research, a lot of good studies about how it can help with healing tissues such as like tendon and muscle. Well, the O-shot is basically PRP injected into the walls of the vagina, into the clitoris, the clitoral hood, and it's supposed to help with arousal, increase sensitivity, and I have looked at all of the evidence-based research out there, and I'm telling you, it's like $2,000. Do not get this. Like, this is such a waste of your money. Anybody that tells you if you take a shot down there, it's gonna help with, like, you know, arousal, you know, sure, maybe, but you're also risking, like, you know, infection, bleeding, injury, bruising. And also, I would argue that if you're having any issues with that type of thing, with arousal, if you're having dryness down there, maybe you're perimenopause or in menopause, there are so many other steps that I would do before I would do something like an O-shot. I don't think there's good evidence for it. I would not recommend it. And if you are thinking about getting it, please talk with your doctor, your gynecologist. See, you know, please talk with a medical professional. There's so many other things. Okay, so I had to get that out there because I honestly was surprised. I did not know that they could use PRP for your vagina or your vulva, excuse me. I have one more question for you. A bad pelvic floor. A question. Okay, so what is a bad pelvic floor? That's an interesting question. You know, a lot of people come to me and they're like, oh my gosh, it looks so gross down there, or oh, it's probably so bad, or it smells, or the color. And almost everybody, it's beautiful. It's normal. Everything looks fine. Maybe you have a little bit of weakness. A pelvic floor dysfunction, to me, I'm not going to say good or bad pelvic floor. I'm going to just say everybody's pelvic floor is different. And maybe you struggle with, let's say, strength. Maybe you suffer from, you know, having some weakness issues. I've said this many times before. Our pelvic floor is made up of 70% slow twitch muscle fibers and 30% fast twitch, which means you're Kegeling, your pelvic floor, you should be able to hold long duration, right? That's the slow twitch. But you also need to be able to activate that fast twitch, that boom, 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 right? When we cough, when we sneeze. If you didn't have a pelvic floor, when you coughed or sneezed, you know, your uterus could just kind of fall out, right? Everything would fall out. I always talk about this when I'm talking about diaphragmatic breathing, that our bodies are like a can of soda, or like pressurized canister. If your intra-abdominal pressures are off, it's gonna cause a lot of dysfunction, right? Acid reflux, hiatal hernias, prolapse. You need to be able to control the intra-abdominal pressures, and one of the best ways to do that is with breathing, right? And like I said, I'm not going to kind of go down the rabbit hole with this, but that's what my method is all about, right? The 5 Bs: breathing, belly position, bracing, bending, and belly support. You need to have all of that. You need to be able to stretch your muscles, your musculoskeletal system. You need to be able to activate the muscles, right? So, and also breathing. I could talk for a whole day on diaphragmatic breathing with you, but I have videos online. If you're interested more about the whole canister method, or the whole idea that our bodies are pressurized cans of soda, link into my bio and click learn more and go to the self-care videos. I have workshops that are with breathing and about my method. They're like an hour long, somewhere like an hour and 20 minutes, but it goes into detail about the anatomy of the diaphragm, how to do breathing exercises, things to avoid if you have prolapse, and then there's also some for people that are pregnant, postpartum. But anyway, Going back to the pelvic floor, how do you know if you have a good pelvic floor? How do you know if you have a bad pelvic floor? Really, you want to go see a pelvic floor physical therapist so they can do an assessment. People always ask me if they can see if I'm doing it right. Well, you can't see really. I mean, there's signs to tell if your pelvic floor muscles are innervated, but to really test the quality of your Kegel, you need to have, somebody go in there, and you'll usually go to this knuckle here, and you're gonna feel. Can you feel the anterior or posterior walls squeeze against your finger? Do you feel that lift up? There's different muscle grades. I have various videos about this too as well, and even a free video on my website. Like I said, again, link is in the bio, but there's me using a watermelon to show you how to test the strength of your pelvic floor. So like I said, it's not just about the strength, right? You should be able to do slow twitch activation, fast twitch Kegels, and also be able to repeat that. So I mean, you could be able to hold a Kegel for 10 seconds, fantastic, once, but then can you repeat that 8 times? Can you repeat it 10 times, right? And you're normal. There are guidelines and there are scales that we use as therapists to grade you, so that way we can document that. But everyone's normal may be different, because you're gonna have other things that maybe have compromised you. Let's say you've had 6 kids, right? Your pelvic floor is not gonna be like my pelvic floor, right? I haven't had any kids. There's gonna be slight differences, but that doesn't mean that because I haven't had any kids that my pelvic floor is necessarily better than your pelvic floor. In fact, I am somebody that suffers from more of a tight pelvic floor, right? That's why I show a lot of those videos with the wands and the dilators, because I want to work on lengthening that. And I talk about this a lot too in a lot of my videos, especially for people that have difficulty with arousal, penetration, pelvic pain. If your pelvic floor muscles are too tight, because our society is all about, tighten it up down there, tighten it up. And like after you have kids and you have that, kind of trauma of, labor and delivery, yes, that is a goal, to work on tightening things back up. But if things are too tight, that's a problem as well. And people don't realize, a lot of people actually have, especially younger women or men, they have a tighter pelvic floor. They have a lot of issues from that. I just had a patient recently, the other day, who has been married for almost 3-4 years, and she still is having trouble having penetration with her husband. So, and who knows why, right? I spoke with her. I'm not going to go into detail, right, because of HIPAA. But, she needs, this person needs to get on a program. There's so many things. It's crazy to me that her primary doctor and all her other medical professionals have not sent her to a pelvic floor physical therapist. It honestly blows my mind. But where I was getting at is that if you want to have awesome, amazing, O's or climax, you need to have that length, okay? Because when a muscle contracts, you need to make sure you also have that flexibility and the stability, right? You need that lengthening to happen, and then you need that contraction. It's the same thing as my biceps muscle, right? If this is my biceps muscle, and this is your pelvic floor, this is an overactive, tight, super, super tight pelvic floor. I'm fully contracted. The muscle is fully shortened and fully contracted. If you ask me to hold something like this, I'm not going to be as strong as if I had my arm right here, right? Now I'm at a better length. And if I had my arm completely straightened, this is a completely lengthened pelvic floor. So you need to be able to have that good excursion. Same thing down below. If you're too tight and you're trying to have an orgasm, well, what is an orgasm? It's rhythmic contractions of the pelvic floor. We are already fully contracted. So the quality of that orgasm, you may be able to achieve it still, but it's not going to be as intense or as good necessarily if your pelvic floor was healthier and was able to fully lengthen as well. So having, what is a good, what is a bad pelvic floor, there's so many ways to kind of go about that. But like I said, if you don't know whether your pelvic floor is tight or weak, you need to see a physical therapist, a pelvic floor physical therapist. They can get you on a program. And like I was saying before, I know it's kind of a difficult time right now with the pandemic and everything. even if you do see somebody via online like this, going through your daily habits, going through your medical history, doing an evaluation, we can still tease out what we think you are, right? Like, do I think I can talk to somebody and sometimes within 2 minutes, I already know what the heck is going on and how exactly to treat it, right? Other people, if I do an objective exam or I have my hands on them and I can actually feel, yes, does it give me a better picture? Always, right? You're getting more evidence, you're seeing more to build your case as to why you think this is causing this. But that doesn't mean that you can't get help online. Okay, so I really urge you, if you're somebody that's not local and you can't see me, or if you don't have anybody in your area, look online. There are so many resources too for pelvic floor and visceral physical therapy. It's like I said, not everybody practices it, but there are more people out there than you think. And I guarantee you, whatever you're dealing with, whatever you think is weird or you're not going to believe this, I hear that every day, and I'm still, people kind of get close to topping of, the most ridiculous thing I've ever heard, but you're not going to surprise, me, and your pelvic floor physical therapist really won't, they shouldn't be surprised. Or, another thing people are afraid of talking about too is, like, let's say they've had old STDs or STIs. It's okay. Let your provider or let your pelvic floor physical therapist know about everything. That's really, really important. Your habits, all of that. You should feel so comfortable to be like, yeah, I've had this, and this, and when I do this, and when I'm on the toilet, this sound happens, and it's this color and this quality, and you want to know all of that. Like if you're having bleeding, right? If you're having bleeding during or after, intercourse, you need to tell somebody about that. That's abnormal. That's not normal, and it's something, even if you've been living with it for years, doesn't mean that you still can't get help for. That's another big misconception. A lot of people think that because their pain is chronic or that they've gone to many doctors that nobody's going to be able to help them, but there are plenty of people that will help you. Oh my gosh, this person is asking me so many questions and I love it because the more the merrier. Hi, it's me again. Let me retype. Okay, they're going to add a new question. If you guys are just joining, welcome. My name is Dr. Kelly Peterson. I'm a doctor of physical therapy. I specialize in pelvic, visceral, and orthopedic physical therapy. I work in Orange County, California, but I also have a lot of online services and information resources. If you go onto my website, I have tons of free videos. I'm working right now trying to hire a video team to help me actually make some really nice videos to upload for my new website, so I can actually put my belly whisper method out there. So just give me a few more months. My friend is going to help me get somebody that I can hire, and we're going to rent a studio, and I'm telling you, I'm going to share with you all the tips, techniques, and how this method can literally change your life. And I know I say that, but it may not. It's not going to be for everybody. I know that, and there should never be, like I said, one size should never fit all for everybody. But I'm telling you, having suffered from IBS, celiacs, ulcerative colitis, what do I have? Internal hemorrhoids. Oh, I don't have a gallbladder. My gallbladder's been taken out. I've had a lot of abdominal pelvic issues, and I have been able to treat all of them with this method. And what's been so amazing is that when I started, when I knew I was going to go to PT school and get my doctorate, I never thought I would go into pelvic or visceral. It just kind of happened. It kind of stumbled upon me, and honestly, it was like, this has meant for me. I literally have so much information I want to share with everybody every day, but I work so much, and I work with patients. I love my job. I love people. So I would love to give out free information all day, but I also love treating patients in person. So if you want to know more about me, what I do, you can learn all about my medical history, all about me on my Instagram, on my website. I know I don't have my messages open on TikTok, and that's because I get a lot of very weird messages. If you go onto my Instagram, you can message me there, or you can email me. That's the best way to actually contact me, bellywhisperoc@gmail.com. Okay, I've been getting some questions. Okay, my new partner and I have had okay. Okay, great question. She's also using the O because TikTok does take down. It's amazing to me. I don't want to talk about this too much because I hate being negative, but I can't tell you how many videos I make for everybody that are so educational and so informative, and I answer so many people's questions in the comments, and TikTok literally removes it immediately. It's so frustrating, and I honestly thought about closing. I thought about getting rid of my TikTok because it's been such a just hassle trying to talk about pelvic health, and it's awkward for me because I have to like tiptoe around how I answer questions by not saying words that are deemed as inappropriate. For instance, I said hymen, and I was answering somebody's question about a hysterectomy or a hymenectomy, and they completely took it down immediately as nudity. So anyway, this person said the O. My partner and I have not had the O, and I've been with him for 2 years. Okay, don't worry, you are not alone, and you may be able to achieve the O. So here's my advice on this, and I will tell you guys that I am not a sex therapist. I am a doctor of physical therapy that specializes in pelvic, visceral, and orthopedic physical therapy. I recommend that you talk also with your primary doctor about this, or maybe you have an endocrinologist. I don't know your age. I don't know if you're what age you are, like if there's menopause, other things going on. But I will tell you, the first step to this is letting your partner know. If you're somebody that is faking the O, that is a problem right there. That needs to stop immediately. And the reason is invitation to go live. That's weird. I'm going to decline this. If you're somebody that's having difficulty, or excuse me, if you're not getting aroused, if what your partner is doing is painful actually, and you're not voicing that, that's a problem. It doesn't mean you have to be, you don't have to be like super blunt, or you don't need to be rude about it, but maybe, and let's just say you're super timid and you're even afraid to tell them then in the moment, then just talk to them after, right? But maybe if you're cuddling, or you're right after when you're comfortable. But the best thing you can do is while you're being intimate with your partner, right? Foreplay, all of that, you need to talk to them. They can't read your mind, you can't read their mind. And sometimes, even if you've been with them for a very long time, they may switch up what they're doing on you, and it may not be something that you like, or maybe they don't even realize that what they're doing is different, or maybe you don't like it anymore. Give them a little bit of direction, right? Oh, a little higher, or oh, be a little more gentle. Like, you can use really nice words. It will not ruin the mood. So if you are having issues, the first thing to do is communicate. Second thing to do is if you think you have anything anatomically wrong with you where you can't reach the big O, then you need to go talk with your gynecologist. I recommend seeing a pelvic floor physical therapist as well. You can also have nerve tests done to see if you actually have a nerve damage or something, pudendal neuralgia, something going on that's actually causing that. But it may be something that's, like I said before, maybe it's not necessarily anything physically wrong with you. Excuse me. Maybe it's a emotional or a mental thing going on, right? Or maybe your partner is doing other things that you don't like that actually puts on the brakes. If speaking of this, I just had a thought pop in my head. If you haven't read, I think I'm gonna butcher her last name, Emily Nagoski, I think. She has a book. It's called Come As You Are. It is honestly my favorite book about O's, and it literally breaks down orgasms in the best way possible, basically letting everybody know about accelerators and brakes and which one you are, and how you can better help yourself for like self-pleasure, all of that. Highly recommend it. Maybe I'll drop it maybe I'll make a video so I can to give it to you guys, or put it somewhere in the comments, but it's Come As You Are. It's a fantastic book, and it can really help with that. But yeah, it's hard. I really want to help answer your question more, but I need more information about you and your partner to kind of go more into detail. So message me or email me, and we can talk, okay? Or maybe if you want like the 15-minute consultation or something, but I would love to help figure out what's going on with that, okay? I just need more information. But like I said, you need to communicate. That's number one. Okay, there was a couple more questions. Any exercises or stretches to help me achieve? Oh, okay, that's a good question too. I think the best thing to do if you're trying to enhance your O's is breathing and stretching before. I have a lot of videos and I have a lot of posts online about pelvic floor stretching, the best stretches, and also how to do diaphragmatic breathing. Even though you might think you're doing diaphragmatic breathing correctly, a lot of us have a really hard time with inferior excursion or being able to breathe downward toward our pelvic floor. And it's not bulging, it's not straining, it's not pushing, but you're literally inhaling and then imagining a balloon is filling and it's dropping down, so that area is stretched out. So this is something, if you can figure out how to breathe and figure out how to breathe with your partner, or even let's say you're single or you don't have a partner, what you can do to practice is if you have like a vibrator or you can use your finger, practicing breathing during your own self-stimulation and self-pleasure, that is one of the best ways to be able to have a big orgasm with your partner, okay? It's super helpful and important. Like I said, if you're someone that's having trouble with this, I would love to talk with you more one-on-one because I don't want TikTok to ban us for talking inappropriately, but I would love to help. Okay, more messages. Hang on. I don't think I missed. Okay. Awesome. If you guys are just joining us, oh my gosh, what are the... I didn't even know people could join you on TikTok. If you're just joining us, my name is Dr. Kelly Peterson. I'm a physical therapist. I specialize in pelvic, visceral, and orthopedic physical therapy. I was just talking about resources and about different ways to do pelvic floor stretching for increased arousal or orgasm. Super important. A lot of my friends actually want me to host a retreat actually in Orange County, or do basically, they're saying it's called like a, actually I don't want to say that word, I'm going to get kicked off TikTok. They basically a workshop on all of this, so I will keep you guys posted if I decide to host something like this. I think it would be really fun. Sorry, I'm getting more messages, one sec. But yeah, for everybody that's joined, I really appreciate all your questions. Not sure if this is the right place to ask. No, your question was great. I think it's really awesome. A lot of us have questions, and it can be really intimidating to want to talk about it online, especially in front of other people. So that's part of the reason why I have my social media. That's why I started it. I didn't start it intending to start a business, but it really took off, and it's something I've been treating with. My method that I've created, the belly whisper method, I've already been doing it for a long time and treating patients in the clinic. And I already know it's been working great, but now it's really exciting that I am able to share that with people all over, right? If you're just hopping on now, I was telling people earlier, I offer online consultations. I'm based out of Orange County, California, but I have people all over. I've had people in Canada, I've had people in Kuwait, I've had people on the East Coast, I've had people in Texas, so I do pretty much anybody all over. Like I said, I specialize in abdominopelvic dysfunction, but I still do your typical orthopedic injuries, neck pain, knee pain, post-op surgeries. But what I really specialize in is, things that people really don't realize the benefit of what visceral therapy can do. For instance, if you're somebody that has had plastic surgery, which, my thing is, if you want to get plastic surgery and that's something that makes you happy and healthy, that's great. My thing is that there sometimes can be scar tissue. Basically, let's say, for instance, you have breast cancer and you get a double mastectomy. There are so many ways to break up those restrictions so you don't, down the road, get frozen shoulder, you don't get neck pain, chronic headaches, right? People that... I can't tell you how many patients I've had that have gotten facelifts and they look fantastic, And I'll ask them, you know, when did your headache start? And they'll be like, I don't know. And then I'll ask, did they start around the time that you got your facelift? And then they'll put 2 and 2 together and they'll go, you know what, I never thought about it. But when you have surgery, when you have any surgery where they're going in and they're cutting through tissue, right? Like they're not just going through the skin, right? They're going to cut through different layers depending on how deep they go. And sometimes that can affect the nerves, the fascia, and those restrictions can affect other places, right? I always tell people this. Let's say you had a hernia repaired down here. If you look at my shirt, if I pull down here, this can affect up here in my shoulder area. Meaning, if you have restrictions, fascial restrictions, musculoskeletal restrictions, joint restrictions, in other places in your body, it can be affecting you either up or down the chain, right? For instance, let me give you a general orthopedic thing. Have you ever, let's think about something that's pretty common. Okay, let's say, for instance, you're somebody that does a lot of sitting, a lot of work, right? If you're somebody that's sitting all day like this with your head and your neck forward like this, it's putting so much strain on all of these structures back here, right? You can get disc bulging, disc herniations, you can get numbness tingling down your arms, right? Like, do you have carpal tunnel or is it actually coming from your neck? By just squeezing your shoulder blades down and back, that changes the position of your head already right there. So same thing I tell people with chronic jaw pain or TMJ. If you have a lot of upper cervical extension like this, and when you go to open your jaw, it's going to affect that joint as well. We have joints all over our body. So everything is interconnected. That's a big thing to get across, okay? So you need your therapist to really look at that. A good therapist will treat your entire body. They will not just treat one thing. I think somebody asked a question. Let's see. Any suggestion on stretches or exercises for tennis elbow? Ooh. I mean, there's lots of great stretches for tennis elbow. Typically, tennis elbow is basically where you're having pain on the outside here on the lateral epicondyle. Golfer's elbow would be on the inside. There's generic stretches or general stretches where you kind of are arms straight like this. You can go palm down like this, okay? But like I just said before, this is a perfect example of the chain. Maybe you don't really need to work too much on stretching, but maybe your scapular muscles and between your shoulder blades, maybe you're weak and you're rounded forward. So every time you play tennis, every time you golf, every time you type, it hurts your elbow. So maybe you need to fix your posture, strengthen your scapular muscles, and then you'll get rid of this pain down here. Okay? So this is a great example, but yeah. Maybe you need to do a doorway stretch where you put your arms, you can't see me because I'm too close, but let's say you put your arms in the doorway like this, or let's say you lay on a foam roller with your arms out like a T. Maybe you need to stretch your pec muscles because then that helps pull you back and you're not rounded in kyphosis, okay? I would do some of those general stretches are really great for tennis elbow, but like I said, you have to see a physical therapist to really know, is it tennis elbow? Is that what's going on, right? Why is it very frustrating? I'm not sure what that was referenced to, but lots of things, yes, can be very frustrating, especially when they're pelvic floor. Oh my gosh, I don't know what else to talk about. I could talk about anything. I really appreciate everybody coming on, letting me kind of talk about, who I am, what I do, how I can help. Like I was saying before, if you're just joining now, I have resources online. I have 2 websites, one where I have basically scheduling and I offer online consultation as well as in-person appointments. That's on thebellywhisperoc.com. I also have online digital content with using the vaginal weights, pelvic wands, dilators, C-section scar mobilizations, how to sit. I have the best video on how to poop. My husband really came in while I was doing it and said, "What are you doing?" I said, "I'm showing everybody how to poop." I have a video where I'm on the toilet. I talk about all the best tips and techniques for how to poop. I think it's $2.99 or $3.99 or something like that. It's on my website, but it's 10 minutes of me educating you on how you can poop easier, especially if you're somebody that has hemorrhoids, prolapse, if you're someone that suffers from bloating, constipation, all of that. So if you're interested in learning a little bit more, like I said, link into my bio. You can access my self-care videos through the link by hitting learn more. You can also stay on that website and go up to the home page and book an appointment with me. If you're somebody that's local, I do offer in-person appointments. But yeah, I appreciate all the great questions. Let's see. I think somebody might have had a question. But I really appreciate everybody. 100,000 people, that's insane. And I am so happy that other people like to talk about weird stuff and they like to talk about intimate stuff, because I think, like I said before, there's a weird stigma around it still, even though, you know, a lot of us actually have these issues going on. So I really appreciate all of the support, especially with all the negative comments, and I get a lot of people reporting my videos because of the intimate nature of it, right? But you know what? If you're out here and you're watching my stuff, it means that you're hopefully comfortable with your body, or you're trying to get on that journey where you can be comfortable with your body, because I'm telling you, you're going to have a better sex life, you're going to have a better, bowel movements, bowel habits, you're going to have less pain. It's going to help you in the long run too, okay? So if you have any more questions that I didn't answer here, you can drop them in the Q&A, okay? But thank you so much, everybody that hopped on. I really appreciate it. And I hope everybody has a good night. Thank you.